Hello and welcome to South First. I am Chetina Belgire. Discussing a cancer, which is the second most frequent cancer that affects women in India, despite the fact that there has been a vaccine available for cervical cancer for 17 long years, including an indigenous one, there are very few takers for it. If only women had themselves undergone screening post 40 years, ensured their daughters are vaccinated against this cancer as soon as they hit puberty, number of women dying with cervical cancer would have been reduced. But 63% of Indian women are not aware of the existence of vaccines and even screenings. How do you get cervical cancer? What are some of the myths around it? Who is at risk? How do we diagnose this disease? And much more. Today we have with us Dr. V Annapurna, Senior Consultant and HOD, Department of Gynaecology Oncology at Shankara Hospitals, to discuss all these things. We welcome you, ma'am.
Thank you. Hi.
Hi, ma'am. Well, first of all, for a layman to understand, could you tell us where is cervix located?
So cervix is located in the mouth of the uterus. The uterus is shaped like this, like a spear shaped, you can call it. And this is the mouth of the uterus. And that is where the cervix, we call it, and that is where the cancer starts. And this uterus normally is located in between the both pelvic bones. So it's not felt, but otherwise for a layman, it's never felt. Yes, it can be felt if you are using tampons or if you are using menstrual cups. So cervix cancer, we all know, have been caused by infections. And what are these infections? These are infections caused by a virus called human papilloma virus. So human papilloma virus is a very common virus, something like common cold kind, like how we get common cold and we get out of it, we get relieved of it. Similarly, this virus, we get it when we are sexually active and very also intimately in contact with the genitals. So, and this generally virus, most of the women who are sexually active will get it in their lifetime. And then everyone generally will have the immunity, like we have the common cold immunity. So to clear this infection, if it persists in our body for a long time, like maybe you can think maybe 2 years or more, or persist for a longer duration of time, or if we have a low immunity, either because of some infections, you're taking some medicines to decrease your immunity. These are the conditions when this virus thrives in the body and gets into the cells and then starts making some changes to the DNA in that area and causes cancers.
Okay. Now that you're saying, please.
Along with this virus, we also have some other things like common infections, like many women will have white discharge. So some of these white discharges may have some bacteria which will help or which have been associated to help stay this virus in body for a longer time, and together this bacteria and virus can cause infections. So that's why we urge women to get treated whenever you have any white discharge or any infections or anything like vagina. Please get it treated. Any diabetes, people with diabetes may have more prone to infections. So these people also should get treated and keep on bay these infections so that virus and infection won't interact and cause more problems in us.
So since you're saying that, most women do get this virus once in their lifetime at least, but are there any women who are at high risk or any conditions which can be categorized as, high risk category? Is there anything of that sort?
So the women who have started their sexual activity early in age, like in teens, if you're sexually exposed in teens, then, or you are having multiple sexual partners, or you are having like this, even more common with multiple sexual partners, but it may also happen even when you are married to one person for a long time. A husband is having multiple sexual partners, either of the things, or the spouse, husband bar spouse, whoever is having multiple sexual partners. These are the risk factors, apart from what I have already mentioned, that immunosuppression. That means your immunity is low, HIV and HBsAg, that virus, that jaundice causing virus. If a person is having, then all these things cause immunity low. People like renal transplants or any chemotherapy patients, childhood leukemias when they are on treatment. So all these are the risk factors which can cause like this virus to stay inside the body. And one more common thing that I see in our parts in South India is the tobacco. Many women in the rural area do chew tobacco, or they don't smoke much, but majority of them will chew tobacco. Or some women also do alcohol, local toddy and all those kind of things. So these things also, apart from the sexual activity, these things also make a woman prone to get this viruses, because smoking is a known risk factor to increase the chance of smoking itself has got carcinogens, smoking or tobacco or anything. And along with that, you have multiple sexual partners with this virus coming in. So it will decrease the immunity. So this will stay inside, virus will stay inside and cause problem.
So that makes, screening also difficult. So how do you think these common myths surrounding cervical cancer is actually affecting women's decisions?
Actually, it is not that. See, many women do not reveal these aspects, even if we ask them directly. No one would want to do it. So it's not about your personal life. What is important to me as a doctor or a physician is that, see, basically, if you, whatever be your sex life, please come and get screened. Screening is becoming difficult because you have to go to a doctor and you have to get yourself tested. But to avoid this, now we have in market what we call self-sampling techniques. Okay. That means there are swabs which are available in the market. On Amazon, they are available. So you just buy those kits. You don't want to come to a doctor. You just buy those kits at home and then insert that kit inside the vagina, rotate it 4-5 times and put it back in that kit and go and submit it in any lab around your place. So that is all that is needed. The main cultural or the inhibition I see from women is that I'm not having anything, I'm fine, hale and healthy. So that is the perception that everyone have. I want to say that HPV infection, unlike common cold, will not cause anything. It will be just sitting there. This virus just sits. It doesn't do anything. It doesn't cause fever like COVID. It doesn't cause cold, running nose, or any vaginal discharge like common cold and all those kind of things. So it's totally, it will just sit inside and cause no problems at all. So many women, when they come to us with advanced stages, they all say, I never had any symptoms.
Okay.
So this is what it is. This virus starts from the time when you're in 15, 20s. So when you're totally hale and healthy, jumping around. So the main good thing would be to get yourself tested. That's why I would recommend every woman to get tested from the age of 25 years. Every 5 years is all that you have to go. Okay. You don't have to run to a clinic every 6 months or 3 months like diabetes, hypertension or anything. No, it is not that. Once in 5 years is all the testing you need. Once in 5 years, you have to visit to a doctor, get yourself tested for this virus. And along with the virus, they will also see the cells, how they are there. So if there are any virus which have a tendency to cause cancers or what we call high risk viruses, then we will pick it up and tell them, look, we may have to observe you for some time. Generally, even the high risk viruses also can be eliminated from the body if the body has adequate immunity. If it doesn't go away, then we may have to do something. So that condition will be all pre-cancer. That means one step before cancer. So once you get yourself cleared, then there's no question of going for cancer.
Okay.
So that's how beautiful this disease is, I would say. We are lucky. Women are lucky. If at all anyone has got the cervix in HPV infection, don't have to get worried. It's just a little bit of treatment that it will need, and you're free of this cancer and all the burden that comes with it.
Or something like that. So here the virus is just sitting, and you're saying that 25 years onwards we have to do screening, test for this every 5 years, right? So despite the availability of vaccination for 17 years is quite a long time, but still 60% of women do not know that there is a vaccine which exists, and also you can avoid this disease altogether. So what about vaccination? What is your take on that? Is it because it's expensive? What is the thing? Why is that most women do not know about it and not going for it?
I'll tell you first why the vaccine has not come to India. Vaccine did come to India in 2009 by a NGO from US called PATH, so which had brought vaccine to India. And then we have had cases where we had vaccinated young school-going children and in 3 states of India. So then there were 4 deaths because of that vaccination, they say, but then it turned out that all the deaths were not because of vaccination. So in India, we have had vaccine from 2009. But despite having vaccination, because of this propaganda that had happened then by the social media telling that vaccine is causing all the deaths, and which was totally wrong, totally unscientific, and at that time. So the government had taken to withdraw this vaccine from the market, and then started difficulty in getting vaccine, and the conduct of that trial did not happen in India. Of 2 vaccines which are available right now in market against cancers. Okay. The first one, which we all might have had in our life, is the HBsAg vaccine. That is hepatitis B vaccine. What does it cause? It causes liver cancers. We do not see so many liver cancers in India, despite the drinking going up so high. The levels are so high of drinking in our country now. Despite that, the incidence of liver cancer is not that high. Why? Because majority of the people are vaccinated. Majority of the present population is all vaccinated. This vaccine, HBsAg vaccine, we get at the childbirth itself. So government had initiated that. Similarly, if we start vaccinating against cervical cancer, we can eliminate it completely from India itself.
At what age do you recommend this, ma'am? Now that we know about this, so at what age do you think we should actually receive this HPV vaccine?
Vaccines have come in the guidelines of the pediatric population, the guidelines that are there for pediatric doctors, IAP vaccination schedule, what we call it, Indian Association of Pediatrics. So in this vaccine is optional. Now, as you have rightly said, India has come forward with this vaccine to be given to all school-going children. This vaccine starts from the age of 11 years. 11 years to 18 years, you can give 1 vaccine and get away with it. 1 dose of vaccine is all that is needed. Beyond 18 years, up to 26 years, you can get away with 2 vaccines, 2 doses of vaccine, 1 dose, 6 months later, another dose. Okay. And this vaccine, almost till now, almost around 135 million doses of vaccine has been given all over the world. All over the world, it's been given. And there has not been any deaths related to the vaccine. Okay. So far, no deaths. And the good part about this vaccine is that there's no virus in it. Okay. No live, dead, or any part of the virus. There's no virus DNA in it. So okay. It's not that if I give you vaccine, what is there is the coat around the virus DNA. We have all the cells have a cell wall kind of things. What is it cell wall made of? It's made of the proteins. So it is this proteins which are taken, and only the cell wall proteins of this HPV virus is taken and produced in the lab repeatedly to make virus-like particles, what we call. It will be just a hollow virus cell body without any content in it. And when you inject this, the body thinks that, oh, it's looking like that virus, and it starts producing antibodies. Okay. So we have very good levels of antibodies when we give these vaccines. And so if a woman who is not sexually active around 11, if a child who is not sexually active at the age of 11 or so, then this is the right time. So once before the sexual activity starts, if there are antibodies in the body, then it's a good thing. The antibodies will take over and clear that virus, and you will not get this virus in future.
Okay. Suppose somebody has missed, now if they are at the age of, say, their sexual activity has already begun and they're at the age of, say 30, 40, whatever. So does this vaccine still work for them? Can they still go ahead and take this vaccine, or doesn't it work? How does it go?
See, at the age of 30, 40 or so, if you're married for 10 years or so, I mean, you're sexually active for 10 years or so, body itself, as I have said, it will get immunity by itself.
Okay.
So to clear this virus. So what you will need then is just a screening once in 5 years.
Okay.
So once in 5 years of screening, if you see whether was there any infection then which has got cleared or not, we will come to know. And if it is cleared, then you don't have to worry for next 5 years, and then come back again after 5 years to see whether there's any more infection existing in the body. So screening process, as I have said, there is a self-sampling techniques which are available for virus. One. The second is you can go to a doctor. If you're sexually active, they will check from down one thing called liquid-based cytology, or pap smear, what we call. So pap smear is tested. What we do is we put a instrument inside the vagina and then look at the cervix. The good thing about cervix is that you can look at it. It's an internal organ, but you can look at it. You don't have to do an endoscopy, some tube here, there, no need of inserting all those things. You just open up the vagina, you can see the cervix. And once you see the cervix, you take some scrapings from it, which is totally harmless. It feels as though someone is touching you, kind of things from inside. That's all it is. There's no pain associated with it. And once you take that and put it on a smear, and we put it on a slide, make a smear out of it, and we test it in the lab, and then see whether there's any changes that have happened on the cervix cells because of the virus. Anytime last 5 years, anytime the virus has come and gone and caused some changes or what, we have to check that and then see whether there's any pre-cancer changes or not. That's all it is. So it is just a 30-second procedure is all that is there.
So any woman who's even attained menopause, and anybody who's undergone, obviously, if somebody has undergone hysterectomy, then is it that they're completely free of cervical? There are two things here. One, menopause. Does that make any difference? Like, do they have to screen even after their menopause? And then the uterus being removed, and then hence the cervix, the chances of cancer being less. So how does it work, the two of them?
So with respect to menopause, yes, the screening should go on till you're 65 years of age.
Okay.
Upper limit of screening is 65 years of age. As I said, lower limit is 25. The entry level is 25. The exit level will be 65, as is given by all. But I would recommend even after 65, even at 80 years of age, I have seen cancer cervix coming in the women. So what I would recommend is, even after 65 also, if you have never got yourself screened before 65, get yourself screened at least after 65. At least one screening should be there in your lifetime. That will reduce this cancer by almost 30%. If at least once a woman has gone for screening in her lifetime, during the time that 30, 40 years or so, that itself has shown that we can reduce our numbers from 19 to 12 or so. So that's how good it is. You don't need to do any extra methods or anything like that. Just all women should come and get themselves tested. If we do in basic, at least one screening without vaccination, without anything also, if you think that vaccine is costly or so, one screening is all that is needed. Okay, I would request all women of India to please get yourself screened at least once in your lifetime. Ideal would be to get it screened from 25 to 65 years. Every 5 years is all that you have to go to a gynecologist and get yourself screened for virus. And if you have children, both boys and girls should be covered with vaccination, HPV vaccination. It's absolutely safe. I have been giving this vaccine from 2012. I have not seen any deaths or any side effects because of this vaccine. It's available and it's done by our own country. That is Serum Institute has produced this vaccine. It is at least one dose is all that is needed. Please get yourself vaccinated.
Before I conclude, you just said boys and girls. So there is many people do not know that even boys can be vaccinated with HPV. So is that important? If you could quickly tell us.
Yes, boys also. See, sexual activity, when you say it is both.
Yes.
Majority of the times it is both. Girl and boy are together. So as I said, multiple sexual partners, even in the husband also, or spouse also can cause this infection. They might be the carriers.
Yeah, okay.
So we have to cover both. We have to cover both. Not only that, it is not that they don't have cervix, they don't get cervix cancer. No, it's not that. They get penile cancers, cancer in the penis because of this virus, cancer in the motion area, that is rectum, anus, what we call it, that is because of this virus. Cancer in the throat, head and neck is because of this virus. So in men and women both, even in women, cervix cancer, yes, is caused by this virus, but also other viruses like even the vulval cancers are caused, external genitalia cancers are all caused by this virus, the motion area cancers are caused by this virus, head and neck cancers are caused by this virus. It's known fact. So this virus is not just cervix, it causes many cancers in both the sexes. So when you have a vaccine, immunize both the sexes. That would give us the best results. This Indian vaccine, we can give it to boys and girls, both.
Thank you very much, ma'am. It was wonderful speaking to you. Thank you so much for your time.
Thank you.